I remember a patient one time that came in, and as I started the assessment and started doing vitals, was pretty happy, looked overall healthy, and I the thought went through my head. I thought, why is this person here? And as we went back to the room and delved deeper into the questions, um, he admitted that he was having some problems with depression and anxiety related to a tragic loss of a close friend. I was able to say to him, could I offer you some prayer right now? And I was actually able to pray with him. One of my favorite aspects of being a nurse here is being able to offer that spiritual portion that is missing so much in healthcare. The focus in a lot of places is on the physical part, and we miss sometimes those deeper aspects that really we need that for the health of the whole person, not just to impact them here, but eternally even. And as far as being able to do that with people, it has stretched me to ask God for bigger things. When you're dealing with someone who's homeless, just got out of prison, they spent the night in their car and they don't know where they're going to have housing, you start to kind of think outside the box and learn to ask God for bigger things. And that's one of the blessings, I think, of being here.
So it would have been a couple years ago when I had a friend that passed away, and I was just having like some really bad anxiety and depression and stuff like that. And I came in here, and it wasn't just that you guys gave me medicine for it, but you guys sat and prayed with me and stuff like that, and that really like helped. Like I remember thinking back to that, like that was something that helped me get through it.
We had in our care an 11-year-old Amish girl last year, and she has been an ongoing case. So it's been a delight this year to see her continuing to improve and thrive. Her condition went from having profound hypercapnia and hypoxia at night to where I believe last year I said she was dying every night. But with the equipment that we were provide for her, she has done remarkably well, and I've had several home checkups with her, and I know they've been in a couple times here for checkups, but most recently she has been doing well. She's thriving, she's gaining weight. As a matter of fact, I need to get a larger BiPAP mask out to her here, and she's just done remarkably well. It's just a joy to see her family with being so relieved at such a dire circumstance, turning essentially 180. An Amish home, it's rather difficult to walk in with high-tech machinery that requires, first of all, electricity. Thankfully, I had a dear colleague that searched high and low because I had struck out in finding this particular machine because we really needed a very specific machine, which was a Respironics ST, and it was a BiPAP unit that we could highly configure to her. It was a little difficult working that all out with the family, but they were great. They just did whatever they needed to do, and they were so committed.
I've had no insurance and been dealing with no insurance for years, and this is a place where I'm able to get some help and relief for myself and other people.
Hi, my name is Shirley Irvine. I started volunteering at the Christian Health Center almost 2 years ago now. I heard about it from a flyer at work. They posted a flyer at the hospital that they were in need for nurses to volunteer, and I came on out. I didn't know what to expect. I'd never volunteered for anything like this before. I've never enjoyed picking up work, so it's really amazing that I like coming here on Saturdays. So for the most part, it fills my heart with joy every Saturday that I'm here, and I have met so many amazing people in my journey of volunteering. And
come in years ago with a heart condition, high blood pressure, was driving truck. Dr. Snyder helped get everything down, and we're back to good health. And
folks here in town who are bothered by cosmetic problems, lesions, cysts, moles, burns, and being able to do something for them at a price that they can afford. And it's immediately helpful to them and satisfying for me. It's a joy also to be able to take time with patients and to pray with them if the Lord so leads, and just to take time to share with them and answer questions. There's not quite as much time pressure to see lots of people because of finances, but we can practice in an environment where we can enjoy the contact with the patient, and patients appreciate that also.
And I've been coming to this clinic for 2 years now, and I just had a spot removed off my nose, a basal cell carcinoma. I found out that's what it was, and I really have, happy with the way it's turned out, that I've gotten this help from the people that's willing to help others, and I'm really fortunate to have that because I don't have the income to be able to afford it.
And I want to share with you a testimony that we heard from one of our patients who does want to remain anonymous. And she says, the Ashland Christian Health Center has been a blessing. I had a non-cancerous mole on my back that needed to be removed because it was itchy and rubbing against my clothing. I do not have insurance, and therefore I was offered an appointment to come to the center to have Dr. Vore remove this mole. I was greeted so warmly by Kathy as I filled out the required paperwork, and Karen Smith put me at ease by her friendliness and helpfulness as she prepped me for the minor surgery.
This is the first time in 40 years I ever had a patient ask to pray for me, and it was really quite touching. He just prayed and asked the Lord to bless me for our services that we provide here, and just continue to increase my knowledge and my compassion and my skills, and that he just wanted the Lord to encompass me in his love.
So I was here at the clinic on a Saturday morning, and a patient came in asking me for a refill of her antidepressant. And it looked like a pretty straightforward visit. I could have walked in, filled the prescription, and left. But after some discussion, asking her if she'd be willing to explore the connection between her emotional and physical health, she began to tell me quite a bit about her personal experiences, a lot of childhood trauma, and then personal experiences currently with both financial stress and marital issues. So what I basically said was I want to do 3 things. I said I'd be glad to refill the medication. I'd also like to have her read a book about the connection between our emotional and physical health. And then I also asked her to contact me back in about 2 or 3 weeks by text message or cell phone, whichever she preferred. So about 3 weeks later, she contacted me with a text message, and that's really what was kind of surprising to me, because in the text message she said, number 1, the medication wasn't very helpful and she was going to stop it. Number 2, she found the book interesting, but it was too emotionally charged for her. The story was bringing up things from her past that she was having a lot of trouble dealing with. And so as I started reading the text message, I thought, well, geez, I've failed as a physician. The medication I gave her didn't work. The book I recommended kind of drummed up some old childhood trauma that she wasn't ready to deal with. But it's the last part of the text message that was really interesting to me, because she ended up spending about 2 paragraphs thanking me for taking the time to listen. And so as I reflected on it, I actually did provide her a lot more benefit than I thought. And it turns out the benefit of the Ashland Christian Health Center for me was the opportunity to listen. And for her, the listening was the best medicine.
I want to share with you a rare instance where a donor actually meets a recipient through our durable medical equipment program. Large items like hospital beds are delivered from the donor directly to the person in need. We had a donor call because they lost their father in this family to a battle with esophageal cancer and wanted to donate his bed. Actually, when the person in need arrived at her home, they talked, and the recipient could use many other medical supplies that the donor had due to the recipient having the same esophageal cancer. And I just want to share with you her message, and you can just hear in her voice how grateful she was and how it made her feel.
Call me on that bed, and she's going to come and get the bed, so I just wanted to thank you for making that happen. And her circumstances is almost identical to what Larry had. He's on a trach and a feeding tube, so she can use all the trach supplies and the feeding tube. So food, and I got high calorie boost, and she can use all that. So I'm just so glad somebody could use that.
I take insulin injections daily, and I am currently uninsured through my employer. Insulin is the medication that I need to survive, to function, and to live. And I'm currently enrolled in the PMAP system, where based on my income, I get insulin for free, which definitely helps me out and my family, so we don't have to pay out of pocket for insulin. I want to thank everybody at the Ashland Christian Health Center for helping me with supplies that I've needed, and just thank God that there's a program in the community that can help me out when I'm in a financial despair.
I remember one Saturday I saw 4 people, 4 separate rooms. Room 1 was a patient who had badly controlled diabetes because he had lost his insurance and ran out of his meds. We were able to provide him with not only prescriptions for the medications, but diabetic testing equipment, and to refer him to PMAP for some of the more expensive medicines, as well as refer him to diabetic education. In another room was a young lady who had fallen off the wagon and was not taking care of her diabetes, and she was feeling really guilty about that. And so I had the opportunity just to share with her about the everlasting love of God for her, and to motivate her to continue to get back on the wagon and treat her diabetes. In the third room was a man that I was seeing back after starting him on medication to treat depression, and he reported how his family interactions had improved so much since his anger was better with the medication. And in the fourth room was a young lady who had walked away from her faith in God because her father had died unexpectedly. And I encouraged her to use the Psalms to help her with her emotions, to express those to God. And I talked to her a few weeks later, and she had started getting back into reading the Bible, and she was definitely feeling like she was growing closer to God. And so there were 4 different people, 4 different ways, and that's what we do at Ashland Christian Health Center, providing holistic care in a Christ-centered atmosphere.